Now, 737, the FDA recently approved the first at-home HPV screening test, a possible alternative to what is known as the pap smear. The new option could make it easier and more comfortable for women to get screened for cervical cancer, which affects over 11,000 women every year in the U.S., and it's highly preventable with regular testing. Joining us now is Dr. Jocelyn Carlo, who is Director of Gynecology at Hackensack Meridian, Jersey Shore University Medical Center. Doctor, thanks for being with us this morning.
Oh, my pleasure. Thank you for having me. Anytime I get an opportunity to speak to women's health and educate women about their bodies and what they could do to improve their quality of life and prevent disease, I will jump at that opportunity.
Fantastic. And this impacts obviously 50.5% of our population and unfortunately does not get the recognition and information it deserves. Tell everyone, especially for those of us on the male side, what is a pap smear? What's it designed to detect? And at what age should women start getting them and how often?
Correct. I'll break that down. So pap smear is a cervical cancer screening test. It helps us detect precancerous and cancerous cells of the cervix. Traditionally, it's been done in a healthcare setting where a woman comes in for her well-woman exam. It's just one part of the pelvic exam that we do. So we traditionally have been inserting a speculum in a woman's vagina. We take some swabs of the cervix, we send them to a lab, and they let us know if there's precancerous or cancerous cells. There is what's also called co-testing, which is the HPV test, which could be run off the pap smear. So there are two separate tests. It's important to explain that to women. There's different guidelines by the American Cancer Society and the American College of OBGYN and the U.S. Preventative Task Force about when to start screening. But in general, and remember, these are guidelines. Everyone's an individual. These guidelines assume average risk behavior. So certain women have different risk factors, so they might not fit quite into the guidelines. But in general, we recommend starting screening women at 21 years old. And we screen them from 21 to 29 with what's called the pap smear, which is just the cytology test, where we look at the cells of the cervix to see if there's any what we call dysplasia or inflammation or what we see the beginnings of cancer or cancer. And then when women cross over to 30 years old, we recommend doing what's called co-testing, which is the more common test that's done. But there are, again, a few variations, and every individual is different. So the co-testing is the pap smear with the HPV test on it to let us know who is at risk, who needs to be screened more frequently if they need additional testing. And in general, those tests are done between 3 to 5 years if they're normal. And we continue testing usually to 65 with some nuances for certain risks.
So, and then we have, of course, HPV, which a lot of people may not realize what that is. Those are genital warts, and it's become way too common in society, unfortunately. And genital warts can lead, not necessarily has to, but can lead to cervical cancer, right? So the beauty now in this is an at-home test, you're saying, and the sooner you detect that you may have HPV, the sooner you could do something about it, right? Or even get people a vaccine beforehand. So let's talk about exactly that we now have that home test.
Correct. So there are lots of strains of HPV. There's over 200 strains. The genital wart strains are actually not the strains that cause cervical cancer. You're correct. But they are the strains that are in the vaccine that we have, the Gardasil vaccine, that helps prevent cervical cancer and genital warts. So the low-risk strains are not what's being tested at the home test, and it's not what's really being screened at the gynecologist's office either. So we look at the high-risk strains. The at-home test screens for the 14 most common, and the two most common are strain 18 and 16. And those are the ones that lead, if persistently infecting the cervix, can lead to cervical cancer.
Every single day, and I mean this, doctor, there is something that is a boom, a light bulb that I learn new on this program. Every single day. I had no idea it was a different strain that causes
there's
cancer.
200 strains.
But because they're so similar, because they're in the same family, you use the genital wart strain in order to create the vaccine, right? To kind of trick your body. Is that how that works?
I don't know the technical aspects, how they run it in the lab, but we don't screen for the low risk strains at all. The only
Gotcha.
way to screen for the low risk strains, if someone has a genital wart, we biopsy it and they run the test. So the PAP is really
Gotcha.
just looking for the PAP smear, and the HPV tests are looking for the high risk strains because those are the ones that could lead to cervical cancer. And that's the
So now,
purpose of
now
the
And I'm sorry, I didn't mean to throw a curveball at you like that. The
test. Okay.
FDA has now just approved this at-home HPV test.
Right.
So why is this such a significant development? How easy will this be for people to get access to, you think?
Well, it is so important. Like you said, there are over 300,000 women in the United States living with cervical cancer, 11,000 diagnosed about each year, 4,000 women die and pass away of cervical cancer. Half of those women have never been screened before. 1 out of 4 women are not getting screening. And there is such racial and socioeconomic disparity between who's getting screened and the mortality. So anything that makes us go from like this many people that we could screen to this many people we could screen, then we're going to pick up people at earlier stages, because remember, this is the virus that's the precursor to cervical cancer. So if we could get them into the doctor's office if they test positive, and we could, cervical cancer is very treatable in the early stages. We have an excellent screening test, and we could treat the precancerous cells before it turns into invasive disease, and we could really impact the mortality rate and lower it, because like I said, only 1 in 4 women are getting their screening. So in order to really reduce that mortality rate of 4,000 women dying a year and even up this disparity, we need to get more people tested. So there are OBGYN women's healthcare deserts in this country where there's no access within 50 miles. So these women could order this test, do the test, and know if they have to travel to see a doctor. There are women that are sexual abuse victims, domestic violence victims that don't have access or feel comfortable in a doctor's setting or a healthcare setting that now could do this in the privacy of their home. There are gender diverse individuals that don't feel comfortable coming into a traditional OBGYN office that could do this at home. So I anticipate we're going to be able to really expand the people that we could screen and then treat and catch at earlier disease and really impact that mortality rate.
That's brilliant. I have a friend of mine who's a doctor who talked to me about something similar, but not the same. But the idea of having a home test like this, in the case of Cologuard, for instance, I
Right.
because I have colon cancer in my family, so I started at 35. I started going for regular colonoscopies just because of it, and because obviously early detection is the best chance for a cure, obviously. And
Right.
I remember my friend saying, while Cologuard is not as accurate, anywhere near as accurate as an actual colonoscopy, you have people who refuse to go for a colonoscopy.
Mhm.
And if you just start detecting even a small percentage of people through Cologuard, at least you give them a head start. They don't rely on that as 100%, but at least you got a head start. And so this is just the idea of providing the access for these women who either don't have an OBGYN, as you said, 50 miles away from an OBGYN and don't have transportation. How the heck are they going to get there? This is just so essential. What a mind-blowing leap
Yeah.
forward, and how much this could help. It is so good to have you on. Please come back. I want to know more about this and any other developments that you could talk to us about. Dr. Jocelyn Carlo, Director of Gynecology at Hackensack Meridian, Jersey Shore University Medical Center. What a great show this morning. Thank you so much for joining us
Great.
with that great
Thank you.
information. You bet.
Thank you.
Have a great day, doctor. Thank you.